Hello, and welcome to The Spark, a view of innovation in healthcare. I'm Rachel Schreiber, your co-host, and in this episode, we're speaking with Mark Sevco, Chief Operating Officer at Sutter Health. With his long history in hospital administration and leadership, I'm looking forward to our conversation today. I'm also joined by Stuart Hansen, CEO of Avenir Health.
Good morning, Rachel. Thank you for kicking us off. And Mark, thank you so much for joining us. We really appreciate having, senior voices in the industry and visible leaders across the space join us for our dialogue with our listeners. So thanks for taking the time. Really appreciate it.
Yeah, Stuart, thanks for the opportunity. Rachel, thanks for the kind introduction. It's a real privilege to be here to dialogue with you and just, share what we're working on and just learn from others as well. So thanks for what you're doing too.
No problem. Thank you. So, before we get into some of the really exciting stuff you're doing at Sutter, Mark, what I wanted to kick off with is something that I think our listeners are always keen to learn a little bit about the passion that leaders like yourselves have in healthcare and what keeps you so committed to changing this industry, which is really hard, as you well know. I love the tagline that Sutter, takes of, patients first, people always. I don't think there's a better way to say that because the experience in healthcare is so human. And usually there's a really human side to folks that make an impact in healthcare. And we call that the Spark. That's the name for our podcast. Would love to just hear kind of what your personal journey has been or what ignited your passion for committing to improve the healthcare space.
Yeah, thanks, Stuart. Great way, I guess, to get started. And, for me personally, I'm passionate about several things. One is the employee engagement within an organization and the culture that lives. And I will tell you why, because if employees are engaged, you're going to have great patient experience. And that's sort of my second passion, which is customer service. What can we do to make it better for patients at the most vulnerable times in their lives? And, one of my reasons for getting into healthcare and my connected purpose really goes way back when I was a young adolescent. My father was a blue collar electrician in central Pennsylvania and got called to work one night to fix an electrical pole that got knocked down by a drunk driver. Unfortunately, was involved in an accident, was electrocuted and killed at a work site injury. But what I always remember is, being shepherded to the emergency department, and they were working on my father for hours, really trying to save his life. And, just being there in that moment, with the nurses that were surrounded by myself and my mother and some of my siblings, the compassion that they provided, was really just stuck with me. And it really made a difference. When the physicians had come out and they really, shared that, I'm sorry, when they said those two words, we knew we knew that was it. And, at that point, moving forward, everything that hospital and their staff did to make, my family comfortable with compassion, was really, truly, ingrained in me. And I always just started following healthcare. Went to college, University of Pittsburgh, and studied mathematics and got my master's in health administration, and really led me into, working in hospitals and working, with physicians and just getting to know and how I could actually make an impact at a very young age. But had a great opportunity, spent 30 years at the University of Pittsburgh Medical Center. Mary Butler Everson was the one who gave me my first break out of my fellowship and hired me as an analyst at McGee Women's Hospital. It was really a great, place to work at UPMC over 30 years. Worked for 8 different hospitals, multiple practice plans, service lines, really had an impact to work with many in the insurance division as well. Land me here in Northern California in a very similar organization. We have 25 hospitals, and a huge ambulatory presence, 8 aligned medical groups, 5,000 physicians. And to go back to your point, the spark is in the organization that I'm at now is how do we make this to be the best culture, putting patients first and people always, which is, something we refreshed with the new CEO and myself and Lobby in an organization, giving us purpose on how we could help our employees giving them the right resources, lifting them up, celebrating them, and getting the right people in the right roles. And so, that's my spark, which is employee engagement. I do love our new mission, patients first, people always. It really aligns with myself, with our team. And we're just really looking forward to making a difference.
Yeah, I love that. Thanks, first of all, for sharing such a personal and tough experience, I'm sure. What a great shout out and inspiration, though, that your father has provided for your career. I remember tracking you years ago when you were at UPMC, and some of the stuff that UPMC was able to accomplish with your leadership was really inspiring. So I never knew that source story. Sadly, sometimes those spark stories are, tough moments. Usually they are, maybe not as tough as that. I can't imagine as a young adult or a young teen experiencing that. But sometimes those are the greatest pivot points, right, to really make an impact and to link that back to. So thank you. But we would love to hear about all the great stuff that's underway. I know you've been at Sutter for almost a couple of years now. Would love to hear how you tie that mission of patients first, people always to innovative things that you do in the healthcare space and ways you're trying to really improve and maybe link that to some of the stuff going on with your innovation lab.
Yeah, we set up an innovation lab here. And really it's like an incubator firm where we're bringing people together in a collaborative fashion to have conversations about not only doing it better, but doing it differently. And, many of us truly believe that healthcare in many ways is broken, which means that we put a lot of complexity on patients, on how they access healthcare, how they navigate healthcare, how the billing system works. And we understand and we're very focused on doing things better in every segment of our business, employee engagement, people, quality scores, our growth paradigm right now. However, we do believe that the best, healthcare industries and the best systems are actually looking to do it differently. And the Innovation Center we set up here in San Francisco on one of the piers, very close, obviously, to Silicon Valley, and bringing individuals together that have ideas around technology, around the digital platform, around new models of care or around new pharmaceutical, medicines or clinical trials, so that we, at Sutter Health, we're blessed to have a large system, have a scale to do things rapidly. So we're in 6, divisions across Northern California. We're not only in San Francisco and Silicon Valley, which are 2 divisions, but we have huge provider presence in the East Bay, which is Oakland, up to Sacramento, Modesto, and all the way down to Santa Barbara. So our structure is, each of those areas have divisional presidents and CMOs and a dyadic partnership. And actually they're managing everything within those divisions. And so I'm blessed to help have a dyadic partner to lead all of those, that's kind of our structure, but we're looking to deploy, new models of care, hardwired best practices, and really accelerate something that's different for our patients. So it's, that's a little bit on the Innovation Center. It's new. We're looking to invest in companies as well that, we're aligned with. And we're really excited about where we're going with that.
Very cool. Is there maybe an example of something specific that your teams are working on that you'd like to highlight for our listeners?
Well, one early one, there is, getting to know a company called a Bridge, which is a little bit of an artificial intelligence company. That's a big part in healthcare as well. And, Bridge is, a company that we really like. When we learned about it, it's a ambient listening device that allows our physicians to use a mobile device. And so if you get the patient's approval, you turn on the mobile device, it's embedded in Epic. It just listens and records the conversation on the exam, which is very confidential. When that exam is done and that whole experience in whatever setting, it documents a very structured note. It takes care of, some aspects of coding. It actually saves our physicians up to an hour and a half a day on documentation. Puts them back to the bedside, face to face with the patients, allowing them to interact. They don't have to sit at a computer and type notes. And then they really like that. I mean, it's it's good for the physicians. It helps them with, taking the burden away from them. And, so we're getting, a lot of enthusiasm around that. And those are just one of many examples that we could talk about. But we're looking to certainly, deploy that across our enterprise. And as an example, we've invested in the company itself through our innovation center. So
Cool.
we've so much into it. Yeah, we sat down, with the leadership team there and said, hey, we believe in this company. We'd like to take an equity position in it. And these are different examples of just aligning, around products that we truly believe are going to make an impact in the industry.
That's great. And
Great.
that really impacts the patients, that patient experience as you're explaining. So you've mentioned dyad leadership. Can you explain what that is and then how that philosophy helps improve the patient experience and the experience for the clinicians as well?
Yeah, healthcare certainly is a multidisciplinary, leadership function, and it's something I'm truly passionate about. Meaning that as an executive and an administrator, always having the respect and the advocacy for what physicians, what providers, what nurses actually do every day, and trying to learn how they think, how they work. Dyadic partnership actually goes way back, to Mayo Clinic, and Mayo way back in the day really developed a model of the dyadic partnership, which is taking an executive, partnering them up with a physician leader, and putting them side by side in a collaborative fashion to move the healthcare industries forward in terms of the operating platform. Now, not everybody, does it as formally, as Mayo or Sutter. Sometimes it's, different models, but that's what we have here. And it's really been great. So in each of those divisions, as I mentioned, I have a dyadic partner who's a chief physician executive at Sutter Health. And he's over all the providers across Northern California. And his name is Todd Smith. He's an orthopedic surgeon. He and I work together every day. We're in meetings together. Sometimes we cover each other, but a great trusting relationship. I bring the sort of the business aspect, the operating model, and he'll bring, the physician, relationships and quality and credentialing but we know both of these things, but we really work in tandem, on that.
Cool.
One of the things Todd and I, really believe, and talk a lot to get that physician alignment is really a simple phrase, which is patient-centered, physician-led, professionally managed. This dyadic partnership is really important for us to accelerate by way of getting physicians to the table and working with them.
That's important.
Yeah, very cool. It's a good way to do it. Very structured.
Thank you. Yeah, we're excited about where we're going with that for sure. It actually, cascades too. Rachel. So it cascades to the point that, in our hospitals, where we have 25 hospitals, we have a president of a hospital. That president of the hospital is an executive who's been trained as a leader, as an operator, but they have a dyad who's the chief medical executive. Now, a lot of organizations have the chief medical executive report to the president, who's an executive.
Right.
In our organization, even at the hospital, they're a dyad. They're at an equal level. And Todd and I actually wrote a curriculum and trained through Sutter Health University, the importance and how to lead a dyadic partnership. And so we actually, white papered and wrote a course, and Todd and I teach the course on what
That's
that
interesting.
a dyadic partner, the importance of trust, leadership, and who takes a primary role in certain things, and how you really have to work together. And we truly believe, it's an accelerant. It's accelerating us faster to make change. And we're really excited about it.
And incorporating more voices and in perspectives. That's
Yeah.
important. Yeah. So what do you think that healthcare can learn from other industries, looking around at the way maybe other industries are operating or, handling customer service? What are some things that you've looked at how other industries are operating and found that, there's some valuable lessons to learn and apply in healthcare?
We can learn a lot. We can learn a lot, and we look to learn a lot. Listening is learning. Learning is listening. And, I think learning from other industries is really quite fascinating. I study this a lot, and I use this, in terms of articulating the why and, the importance of us not only to think better and bigger, But clearly, what I'm very focused on as an executive leader is operational excellence, which is
Right.
hardwiring best practices to get better at what we do, to be most efficient. However, there's that second aspect, which is, how do we do things different? We get better, but we also have to be different. And doing things different, because the healthcare system, as we talked about, is, somewhat broken. So let's just talk about many different examples. Ford, as an automotive, company, always focused on getting better. Their company was so obsessed with getting better, and they were really great at that. However, they didn't focus on being different. And so Tesla,
Right.
man, they were different. They had the electronic car. Now, Ford could have done that. They knew that, but they just were very, very focused on getting better. And, you could talk about BlackBerry. If you remember the BlackBerry,
Right.
my age,
Yep.
they could not focus on being different. And then they knew that, apps were coming out, and the iPhone was working on that,
Yeah.
but they refused to change their model. Same thing with Blockbuster. You look at Blockbuster, they had the opportunity as a company, where the individuals who started Netflix went to Blockbuster, and they had this idea, and they said, we could work together. And Blockbuster said, why would I want to do that? I have bricks and mortar
Right.
all over the country. This is our model.
Right.
It's working well. We're making money. How
Right.
that story ended. I mean, they went back.
Right.
Netflix is probably one of the most profitable companies. I mean, we could go on and on. Amazon is a game changer. We have so many disruptors in healthcare right now, where for-profits have huge capital to be able to do things, differently. For us in healthcare, we typically run, a margin, 2-3%. Sutter's doing great, and we have the opportunity because we're, having success, and we're financially, stable, and have a very strong balance sheet. So we're looking to do things differently, around the mobile device, around digital platform, around meeting our patients where they want to be met.
Right.
So, we're really looking to stand up, a different product to be able to, allow us to be able to provide the full continuum of care. And Amazon, bought One Medical, and they provide this virtual platform. However, when they need a specialist, and Amazon,
Right.
One Medical is really strong here in Northern California. We work with them, and we're partners with them because they have to refer their primary care model virtual first, but they really need, others to, rely on specialists. So, I think we have a lot to learn. Yeah, Rachel, it's a great question.
Can I jump in? I want to link to
Yeah.
something you've mentioned, broken a couple times, Mark, and a lot of people say. I mean, I just got back from one of the large industry health conferences out west, and everybody says it's broken, right? There's things that are broken. What strikes me about connecting that to your leadership model, the dyadic leadership model, there is that there's a difference between being broken and being complicated or being complex. And I think a lot of people mistake complexity for something that needs to be completely re-engineered as opposed to just done differently. So I'm connecting a few things that you've just mentioned, kind of,
Yeah.
not even really trying to necessarily thread those together, but I think it's really important that folks recognize the need to recognize the complexity, which is probably where your physician leaders get really heavily engaged in. Hey, we could do something totally different, but that's not practical, or that doesn't meet our physicians or our staff or our systems where they are. Is there a specific example where you think, like, maybe something came to your innovation center or some idea came up internally in terms of something that needed to be retooled or reimagined or disrupted, right? Which is one of the big words in healthcare that always fails to recognize the complexity, and a lot of disruptive ideas that are great and grounded in other industries or other examples, but fail in healthcare because they fail to recognize that complexity or
Mhm.
adapt to the complexity. Any specific examples that you can think of where those kind of weave together?
A great opportunity to double click on this and go a little bit
Yeah.
deep on complexity versus broken. And
Mhm.
as leaders, we cannot lose focus of what we have in front of us right now, which are patients that need us every day
Yeah.
to take care of them. And that goes back to the patient experience and the employee engagement and the culture that we have. At Sutter Health, we have 57,000 employees, and we have 5,000 aligned physicians. and work with a lot of private practitioners. That's part of the operational excellence of waking up every day with the privilege to, to make them proud to work at Sutter Health and to take care of our patients that, are in front of us. And so we talk a lot about, I'll bifurcate this in terms of, we as an organization know that we make it complex for patients in terms of how they access us and how they interact with us and how we communicate. And so that's where we're really focused on doing it better. How do you hardwire a best experience, lift up your patient experience scores? How do you hardwire an organization to recruit, train, and retain the best? And so we have an operating platform and model that we're doing that. So we're making day-to-day impact. We're improving our metrics. That's a privilege. And, we learn from each other and we learn from other industries. And the brokenness is terms of healthcare and where we're going as an organization and as an industry in terms of, the payer, provider, the sustainability of healthcare. It's very expensive. It's very difficult to access. And, that's where doing things differently is going to be important. And so, an example of that would be, where we're setting up a clinically integrated network and moving and working with our physicians and insurers together to create a more sustainable model where we can lower the total cost of care, but enhance quality and access in the meantime. And so right now there's always this, the insurance model and the provider model, and it's still, in many ways, Stuart, it's a fee for service model. And then, and by just natural human behavior, if you're paid a work RVU and you're paid, for a fee for service, the more you do, the more you generate income. That's where it's a little bit broken because the inflationary measures in healthcare, the headwinds that we have, with wages, with product inflation, with pharmaceutical use, those could be still 5-6% per year. Now, the insurance companies and Medicare, for example, they're rolling out a lot less reimbursement than that because they can't afford to do more than that. So that's not a sustainable model. And so, for us, we're really trying to say, okay, let's do some new models of care. Let's actually look to shared incentive plans with our physicians, take shared risk, actually, ultimately, capitation in many ways, going back to the old days of, that model. I think we can do it. I mean, it's just going to take time and you got to do it in stages. And, but again, we're not losing focus of what we do every day, but we're focused on being different as an organization and being the best in this space.
You're hinting at two things that I'm really passionate about. One is the move to VBC, I think you hinted at in your comments, is really going to help align some of the brokenness of the incentive structure. But the other thing that I think is really important, especially behind the patient experience, is driving administrative efficiency and just removing a lot of friction, right? We know far too often you hear examples of really great patient experiences from a clinical perspective, but those getting broken because of the financial experience or the billing process or the binder of EOBs and medical records that patients have to carry around from one physician to another to answer their own questions. That friction has to come out of our system somehow. And that's one of the things we're obviously really passionate about. And sounds like even some of the abridged examples that you talked about is designed to help streamline and reduce some of that burden on the physicians while they're providing care, which it really resonates with me. So thanks for letting me detour a little bit, Rachel. I'll turn it back to you.
Make one other comment too. I mean, I think, Epic is one of the electronic health medical records out there. We're fully embedded in Epic throughout our organization. So they're a great partner who also are bringing technology and tools. They know where the industry needs to go. Now, they're actually doing a better job than I've ever seen them do in terms of working with organizations like Abridge and embedding those tools within Epic to accelerate. I think the digital platform on how patients want to interact in terms of, going back to one of your earlier questions, the airline industry. Can you imagine calling an airline industry, getting on the phone and say, I need to schedule a flight and I'm going here. And that's the way it used to be.
Right.
You can't even talk to somebody in the airline industry, nor would you want to.
No.
Well, where they got it right is they got the digital platform. You can go to your mobile app. You can schedule your flight wherever you want to go. You can change it, modify it. In healthcare, we're really trying to catch up. We're launching at Sutter Health. If you want to schedule an appointment with a primary care, with a specialist or an imaging appointment, You go to a mobile app, you can schedule an appointment. Now that might not be for everybody, but we have to, again, we really have to move our organization to the digital platform, and we're making great progress in doing that.
That's great. So just to wrap up, what key phrase or how would you describe the vision briefly of what you're working to create at Sutter Health?
Well, at Sutter Health, we've refreshed our mission, vision, and values, which gives us a lot of spark internally, to be honest, around putting patients first and people always. And we live that. We start every meeting with a win. As it relates to kind of one of our taglines that you would see in our marketing campaigns, getting better never stops at Sutter Health.
Nice.
And from a science perspective and from a center of excellence perspective, we want to be viewed as to our patients as we're unstoppable in terms of our relentless pursuit of excellence. And, I think that, as an organization, we truly believe that we can make a difference, and it's a privilege to be in a leadership role today in healthcare. I would say one of my personal phrases, Rachel, if you want to go someplace you've never been, you have to try things you've never tried. And I say that all the time to my team, and allow them the opportunity to think big, to think bold, to try new models of care, to try new things. Now, we can learn a lot in our industry around best practices, and I'm very focused on that from a leadership development perspective. What is a best practice? How do you teach it? How do you hardwire it? And then you're going to get more efficient. You're going to remove the waste from the system. This is a very, a strong platform that myself and my team are working on. The operating calendar, the operating rhythm. We meet on a monthly basis to do business reviews with all of our divisions, and then we have weekly, a cadence on some meetings and a daily cadence on some meetings. And so the process of what we put in place to lift up and do better for our employees, for our patients. If we do those things fundamentally, getting better never stops. Our quality will be good. And our growth mindset here at Sutter Health is, we're building 20 ambulatory sites right now, or we're going to build 30 additional urgent care sites. We're believing in the platform of ambulatory as a more affordable model. We're moving business from inpatient to outpatient purposefully. Right. We're preparing for the future. And, I think that takes, a purposeful leadership. Warner Thomas is one of the best CEOs in our industry. He's just, really relentless about these things, as am I and my team. I really appreciate the opportunity to dialogue with you today about this, and also listen to your other podcasts to see how we can learn from others.
Well, thank you for sharing that all today. It's really inspiring, and continue that transformation and that focus in healthcare. That patient experience and that physician collaboration is really important. So thank you for joining us today. And
patients first, people always. Really appreciate it. If folks want to follow the stuff that you're working on, Mark, I noticed you're pretty active on social medias, LinkedIn, probably your best profile for our listeners to follow up and watch the ongoing progress you make.
Always looking to pay it forward. I like a head coach would say, for their team, what we'd say here, as we close something out, patients first, people always. So
awesome.
Thank you both for the opportunity to share our story, a little bit of our journey. And again, the opportunity to pay it forward, if ever given the opportunity, is really something that we look to do, and learning from others as well. So Stuart, Rachel, thank you.
Thanks a lot for your time. Thank you, Mark.
Thank you, Mark.
Take care. Bye.